Hey, welcome back to the show. If you missed my episode last week with pelvic floor specialist Christina Walsh, make sure you go listen to it because it was packed with valuable information for all women, but especially those of us in midlife. So today I want to dig a little bit deeper into vaginal health and why it's so important, especially in our perimenopausal years. Now, you may be noticing some changes like vaginal dryness or discomfort, especially during intercourse. Maybe you're dealing with some increased UTIs or yeast infections, or you've noticed a shift in your vaginal odor. If so, this episode is for you. So, this may come as a shock, but your hormones play a massive role in your vaginal health. The good news is you have options to support and even restore that vaginal tissue. I don't know about you, but I don't just want to feel good, I want to look good everywhere, including my vagina. I would like it to be nice and plump and lubricated. So, we're going to cover how estrogen impacts your vaginal tissue and pH, why changes in your pH can increase UTIs and infections, the benefits of vaginal estrogen and why it's safe for all, non-hormonal options like DHEA and other over-the-counter products, some supplements or nutrients that can improve circulation and tissue health, as well as how vaginal tools can support blood flow and elasticity. So let's get into it. So there's a reel going around Instagram and probably TikTok, although I don't hang out on there. I'm too old for it. I can barely keep up with Instagram, but it is from Dr. Rachel Rubin. I will link to her website in the show notes, where she essentially says in this video that women lose their labia minora, also known as the inner labia or inner lips, during menopause. And women are going wild in the comments in utter shock. They're like, does it just fall off? Where does it go? I mean, it's kind of funny, but I'm also like, hello, what have I been saying? Your hormones impact everything, including your vagina. And if you followed me on Instagram or you're on my email list, you know how important vaginal health is. I've talked about it before. So we're going to really dig into it today. Now, what happens? Estrogen plays a huge role in keeping your vaginal tissue thick, elastic, and well lubricated. All the things we want. And as estrogen starts to decline in our perimenopausal years, we start to see several changes, like the vaginal walls thin and lose elasticity. That's going to lead to discomfort and pain, especially during intercourse. There's less natural lubrication, which can make intimacy really uncomfortable. This was actually one of the first symptoms that I was dealing with when I started perimenopause in my 30s. Nothing was going up there, and it was not fun for myself nor for my partner. And then, of course, there's pH levels that change. So they start to rise, and that makes the vaginal environment more alkaline. And this allows bacteria to thrive, increasing the risk of recurrent UTIs, bacterial vaginosis, and yeast infections. So if you notice an increase in any of these things, please keep listening because this episode will really help you. There's a lot of providers out there who will prescribe antibiotics for any of these things. And listen, sometimes there's a time and place. However, you don't want to overuse antibiotics because that will greatly throw off your gut microbial balance, which not only is going to make you more vulnerable for these recurring UTIs, but it's going to put you at risk for a lot of other health issues. And we see this quite often with clients when we run a stool test specifically with them, where we see some inflammation, just bacteria imbalances, and they often have a lot of different health symptoms that go along with that. Your gut health really, really matters. And we have a gut microbiome as well as a vaginal microbiome. So the other thing that I mentioned is some odor changes. Now, there are women who notice a shift in that, and usually it can be kind of embarrassing. It's a lot more, a stronger odor, and that is due to changes in that vaginal microbiome and moisture levels. So I want to shift focus a little bit to vaginal estrogen because there is a lot of conflicting information out there, misinformation, and it's not just on the internet. I'm talking about even in your doctor's office because, as you know, if you've been paying attention, many doctors just do not have this education. It is why I do what I do, because I want you to have information so that you can better advocate for yourself, right? So vaginal estrogen is safe for all women, even those who have had cancer. So, unlike systemic hormone therapy, vaginal estrogen works locally to restore moisture, elasticity, and pH balance without significantly entering the bloodstream. The reason for that is it is very low dose, whereas systemic hormone therapy, like a patch or a gel or a cream or a pill or an injection or even a pellet, those are going to raise levels in the bloodstream. When you use vaginal estrogen, whether it's prescription or even over the counter, it is low dose, so it will not enter the bloodstream. It just works locally. So there are some different options available. There's the FDA approved vaginal estrogen like Estrace, which is a cream, Vagifem, which is a tablet, or a low dose estradiol ring like E-string. Then there's compounded estrogen creams that, of course, you would get via a compounded pharmacy, and they tailor those to your individual needs. Then there's also DHEA suppositories or something called Intrarosa, which is non-estrogen, but it's still a hormone, and that's going to support that vaginal tissue. DHEA is actually very good for supporting vaginal tissue. Most doctors who are knowledgeable will agree that vaginal estrogen is a game changer for perimenopausal and menopausal women dealing with dryness, discomfort, UTIs, and all the different symptoms that I mentioned earlier. Unfortunately, some of the prescription vaginal estrogen brands that I mentioned have some gnarly ingredients, including parabens, which we typically want to avoid. And since vaginal application is best for absorption, you don't want to be absorbing some of these ingredients. So do your due diligence to see what the inactive ingredients are, if you're sensitive to them, or even look them up on EWG Skin Deep to see what their safety profile is. That said, it's important to weigh the risks versus benefits with your provider to find what works for you and your budget. I personally use an over-the-counter vaginal estrogen from Dr. Michelle Sands. It's called Glow Below, and I will link to that in the show notes. Again, it's an over-the-counter option. You could just go to her website and purchase it. You do not need a prescription. You do not need a doctor to write that script for you or order it for you. And it has such beautiful, clean ingredients. I just think it's wonderful, a really great formulation. Now, there are some different variations that she sells. She has, I think, one without hormones, and then there's one with estradiol and estriol, so it's typically called Biest. And then there's one with just DHEA. So it really depends on your needs and your preference, but there's a few different options, and I just think it's a really great product. Now, let's talk about some non-hormonal options to consider just to help with that tissue, dryness, and some other things that may be occurring for you. So there's hyaluronic acid based moisturizers. That's going to give hydration without hormones, and that helps to retain the moisture and improve tissue health. Then there's vitamin E suppositories. These have been around forever, and they do alleviate symptoms of vaginal atrophy, including dryness and discomfort. Clinical trials have reported significant improvements in vaginal health among postmenopausal women using vitamin E suppositories, but that does not mean that you can't use them in perimenopause. Then there's pH balancing suppositories with boric acid for occasional infections or irritation. Some women like to insert them prior to sexual intercourse. Then there are some probiotic supplements with specific strains to support a healthy vaginal microbiome and reduce UTIs. We actually give our clients a vaginal microbiome protocol for those who are struggling with vaginal related issues, but we give them that education regardless because, like I said, it's really important. And especially if you have some GI imbalances, it is all connected. So you do want to take care of all of that to feel your best. Then there's nitric oxide. This improves circulation to the vaginal area, and that's going to support lubrication and even arousal. So nitric oxide, or NO, plays a role in enhancing blood flow to the genital area. I'm going to link to a study showing that topical NO can significantly increase clitoral blood flow. Hello, better orgasms, with potential therapeutic benefits for female sexual dysfunction. I'm also going to link to an oral NO supplement that I personally like. And then, of course, there is lube. Everyone, in my opinion, should be using lube if necessary, of course. It just makes things glide easier, it makes it more comfortable, and everyone enjoys themselves. I rarely have intercourse or self-guided pleasure without lube. There are so many great, really clean brands on the market right now, but one that I am loving is Biphoria Wellness. They actually have a couple of different ones. Some of them have CBD in it. Oh my God, they just have really great products, and it is a good time for all parties involved. I'm going to link to that in the show notes. All right, so let's move along to some vaginal rejuvenation tools. There are some emerging therapies that can help vaginal or that can keep vaginal tissue healthy. So there's red light therapy. Red and near infrared light can help stimulate collagen production and improve circulation. I am a fan of red light therapy myself. I don't use one specifically for my vaginal area. I use it for everywhere else on my body, but I may be buying a product myself just because why not? I like to experiment and see how things work. Then, of course, there's vibrators and sexual stimulation. So regular stimulation increases blood flow and oxygenation, keeping vaginal tissue healthy. So there's a website called mv.health. I'm going to link to that in the show notes, which offers a range of FDA registered and clinically proven medical vibrators. How cool is that? Designed to address various urogynecological issues, including vaginal dryness, pain, arousal, and orgasm difficulties. These devices are FSA or HSA eligible and have been developed with input from leading urologists, OBGYNs, and pelvic health experts. They have 4 different devices for women to address different issues like weak pelvic floor, arousal issues, pain, and even circulation. All right, that was a lot. Now, if you have been struggling with vaginal changes, please know that you do not have to suffer in silence. There are obviously a lot of solutions. That was just scratching the surface, whether it's hormonal, non-hormonal, or even lifestyle based. Vaginal health really is a crucial part of perimenopause. And like I said, you have options to keep it in great shape. Vaginal estrogen is safe and highly effective, but if that's not for you, there are plenty of non-hormonal solutions, supplements, and tools to explore, like I shared. So if you found this episode helpful, please do share it with a friend who needs this information. And if you have any questions, feel free to reach out. Make sure you leave a rating and review. It really helps us get the perimenopause message out to many, many more women. And thanks for being here. I appreciate you listening and hanging out with me here on Perimenopause Simplified. Until next time, my friend. Hey, before you go, if you're ready to get educated, empowered, and feel your best in your peri years and beyond, grab my must-have guide for women 40 plus navigating hormone changes via the link in the show notes. You'll learn my top 5 strategic diet and lifestyle changes to make ASAP to support your declining hormones and get back your energy, improve your mood, and confidence. The information provided is for educational and informational purposes only. I am not, nor do I act as a doctor or any other medical professional. I am not providing healthcare, medical services, or attempting to diagnose, treat, prevent, or cure any physical, mental, or emotional disease or condition. The information shared is not intended to be a substitute for the professional medical advice provided by your own medical or mental health provider.